Hello, everyone, and happy Emergency Medicine Day to you for May the 27th, 2024. I'm glad that you can join us and watch this video. I'd like to introduce Dr. Roberta Petrino, who is the head of the emergency departments for the Ticino Department of the South of Switzerland, a previous EUSEM President, and is now the lead of the Emergency Medicine Day Working Group. You might have seen me from the GreenED before. My name is Sandy. I'm the Environmental Specialist Interest Group Chair for the Royal College of Emergency Medicine and the co-clinical lead for the GreenED, as well as an emergency medicine consultant in Fife. It's a big day today, Roberta. It would just be great to hear from you about the reason why we've decided to choose the environmental crisis, the climate crisis, as the focus for the Emergency Medicine Day.
We decided to choose this. Actually, it was the Council of EUSEM that voted among several possible items, because every year for the Emergency Medicine Day, we are looking for something that is important to explain or to show to the general population, because the Emergency Medicine Day is the celebration of emergency medicine for the public, for the politicians, and so on. And so we really felt that the climate change, the climate is going to be a real problem and a real burden for the emergency departments and for the EMS in general, so the emergency medical system, because we are seeing a lot of problems that are going on our shoulders. After the pandemic, that was not so much related to climate change. Now we have a lot of problems with, for example, with floods, with drought, with heat waves, with newborn diseases. Even in our Mediterranean regions, we are seeing now Zika and dengue fever and diseases like this that we were not used at all to see. And so apart from a real environmental and ecological point of view, we think indeed that the climate change is an emergency for our emergency department, and we need to be prepared.
I'm glad that I can now welcome Dr. Garcia-Castrillo, who is a past president of the European Society of Emergency Medicine and previously worked as an emergency physician in Santander, who's also been working on the Emergency Medicine Day 2024.
We have information from at least 53 countries. It's not the whole world, but there's a substantial number of countries respond to the survey creating focus group. The general idea is that everybody is concerned about this. The level of concern, let us say, in a rank scale of from 0 to 9 is close to 8, so it's really high. This is one aspect. The other aspect is that, as Roberta really highlighted very clearly, there are big differences in between what are the concerns and what are the solutions. And it depends, of course, the geographical aspect, because some people never saw a flooding, others never saw a heat wave or a cold spell or a heat wave. So there are big differences. This is an important issue. But the other thing is that we found that the preparedness, I will say, was from middle to low, what the people report. Not only the preparedness for the health authorities, but also the preparedness from the scientific societies or the local groups in the emergency department. So I hope this survey, at least in those areas in which they have fulfilled it, they have created the interest for this topic, and probably the group has gone on working and tried to improve the preparedness, because preparedness and planning was one of the solutions that everybody report in their conclusions, because we asked for that. So the idea when we started with this was to increase the awareness of the professionals first, of the citizens and the politicians and other stakeholders, just to try to get prepared to what is going on now. It's not for the future, it's what is going on now, and probably is going to be worse in the future.
Thank you very much. And so we heard from Roberta just before that people are feeling the effects of climate change in their emergency practice all over the world, with examples of dengue fever entering the kind of Mediterranean area, and we've seen forest fires and floods and kind of crop failures around the world. I was just wondering what you both think the results of this project that you've done will be able to help us show, and how the climate crisis is affecting emergency medicine worldwide, and maybe what we could do to in response to some of these answers.
Well, and I start just from a general point of view. I think that this survey and the fact that we obtained the results from all over the world, so not from all the countries, but from many countries around the world, is important because it raises interest and awareness. And also the responses that Luis will explain you a bit better are really interesting, because we saw that the climate change is something that is warning people, so the professionals, but not only the professionals. There are differences, of course, as expected, from rich countries and poor and less rich countries, but it is a problem that is felt very highly from professionals in particular. And I think that I don't know, this survey will bring some data more than what is already available. I think that something that may happen after the publication of this survey is a kind of position statement or a common document where we can claim something and ask something and ask some action, specific action. It is particularly important, for example, what you are doing in RCEM, that is this environmental and GreenED initiative that is really, really important, something that may help everyone, indeed.
Thank you. Yeah. And I think it's really good to get information from all over the world and show that it does mean something to emergency physicians. I was just wondering if there's kind of any other final remarks or anything you'd like to make about today or Emergency Medicine Day in general, or any calls to action that you think that we could do to help further the cause of promoting emergency medicine and trying to make it more sustainable and adaptive for what's to come.
My final remarks is that in general, I think it is important for everyone to celebrate the Emergency Medicine Day, because it is really our day. So the one that is uniting everyone from every society, group, etc. And maybe this theme will remain the same more or less for a few years, because the problem is just at the beginning. I think it is very significant, because there is a lot of interest already in general around climate change. And the problem is that there are still many people and many and also political parts that are trying to deny the problem. So to have some scientific data that are saying the problem is here and we have such a problem and we need to discuss more about this is important. So I think it's a very good occasion, and we hope indeed that our voice will be replicated more and more times to arrive everywhere.
I think that probably is not only to be more educated, but also to increase the role of emergency medicine to become strong leaders in this area. They are going to call experts. The authorities are going to prepare and ask for the experts, and probably we have to be there. We are in the front line. We are the safety net, so we have to be involved in this aspect and try to move to something that you mentioned, to be less reactive and more proactive, and try to plan for the future.
Yep.
That's great. Thank you very much. I had to mute myself because I'm recording from an emergency department and there's an alarm going off as per usual. So I'll be celebrating Emergency Medicine Day by working that shift, which is one of the reasons why we're doing this. out of time. So just thank you so much for the time that you've given us today. It's really interesting to have the climate crisis as the focus for Emergency Medicine Day. And we're just honoured to have you speak to us. We'll be sharing more things about what we're doing at the Royal College of Emergency Medicine. And if this has really piqued your interest and you're an emergency physician out there listening to us, then please get in contact either at the GreenED or at RCEM if you're in the UK. Or through any of your local emergency medicine societies around the world. There are people out there wanting to tackle the climate crisis within the emergency world. So it'd be great for you to join us. Thank you very much.
Thank you. Thank you.
Thank you for your interest.